Hello, everyone. Welcome to Health Professional Radio. I'm your host for today, Tabetha Moreto. Our guest today is Dr. Jacques Miller, a distinguished research scientist. He has been honored with the prestigious Japan Prize for his world-changing discovery of T lymphocytes, which are responsible for protecting our bodies from infection. Without further ado, welcome to the show, Dr. Miller. It's wonderful to have you here.
Well, thank you very much.
First of all, Doctor, I want to say congratulations on this reward. You must be very proud of your research.
Thank you very much. Yes, I'm delighted to have received the Japan Prize. It's a very prestigious prize given by your peers who know about your work and find it significant.
Very interesting. Can you please tell the audience more about yourself and the nature of your work?
Yes, I did medicine at the University of Sydney, and then I went to London to do a PhD in cancer research. And during my PhD, I found out that the thymus, which is an organ below the sternum and above the heart, is highly important. It was thought to be redundant and useless, but I found out that it makes lymphocytes, which are now called T cells, which patrol the body and make sure that infections are fought, so that it removes virus-infected cells, and it also tries to destroy cancer cells.
Yes, wonderful. So, Doctor, with this research that you have done, so who does it benefit?
Well, it would benefit many people because we know now that T cells fight off infection. We know that when things go wrong in the thymus, you get autoimmune disease like rheumatoid arthritis and diabetes. And now we know how to make sure that T cells can attack and destroy some types of cancer cells.
I see. I'm sure that this will benefit many people around the world, millions of people who have cancer.
Yeah, well, at the moment, it's only about 20% of melanoma and a few cancers like lung cancer and kidney cancer, but not all types of cancer. We have to work harder to find out why it's not all types.
And speaking of all types of cancers, what is your next step, Doctor? So what is the next part of your research? What are you going to do now?
Well, I'm officially retired, but I can talk to young people who are doing research at the institute where I work, and we just plan experiments. For example, we want to know how T cells can be educated to prevent autoimmune disease. That's the step we're looking at.
I see. And Doctor, if you don't mind, I'd like to ask you a personal question. Why are you so passionate about this type of research? Why are you so passionate about science and medicine?
Well, I think it's so interesting. I mean, I'm very curious as to what happens, especially when things go wrong. You have to investigate the reasons why they go wrong, because normally they shouldn't go wrong. So there must be something wrong. And that's very exciting, because when you find out why and you can do something about it, well, you get such a thrill. It's very, very, very exciting.
Yes, that's right. That's true. When it comes to medicine and science, there's always new things to discover.
That's right.
How about when you were young, Doctor? Were you interested in science and medicine?
I was interested in medicine from a very early age. One of the reasons was that my elder sister contracted tuberculosis, and my younger sister and I did not. And I always wondered, and we lived in the same room, in the same house. So I always wondered, why is it that she went down with tuberculosis and we did not, in spite of the fact that we played together?
I'm so sorry about what happened to your sister.
Yes.
So, Doctor, tell us, are there any misconceptions regarding your research that drives you crazy and it keeps you up at night?
Yeah, well, it depends what happens. I mean, if you're trying to find a solution to a problem and you don't, well, that keeps you up at night because you want to find a solution. But normally the work goes well and you're just excited about it and you can sleep well.
Yes, I absolutely agree with you, Doctor. When you can't find a solution to something, that drives a lot of people crazy. All right. So, Doctor, aside from this research regarding cancer, what other research have you done before?
Well, most of my work was on T cells, T and B cells. The two types of lymphocytes that I discovered in 1967 to 8 were called T, for thymus-derived, and B cells, which make antibody, and they are coming from the bone marrow, not any other places. So bone marrow-derived cells, they are abbreviated as B cells, and thymus-derived cells as T cells. And we also found out that T and B cells talk to each other. They communicate. T cells help B cells make antibody.
Wow, so these cells really talk to each other. Very interesting. Thank you, doctor, for sharing this. This is something that I just learned today, thanks to you. So before we go, what is your main takeaway message to all of the listeners of Health Professional Radio? What would you like to say to them?
Well, I think it's very important to ask the right questions and to formulate the correct hypothesis, and of course to follow up what you're curious about. It's very interesting to be curious about certain things that go on in the body. So I think research is very important because it's the only way we'll ever find out what goes wrong, and that's what we have to deal with. People who have diseases, something has gone wrong. We have to stop it.
Excellent message, doctor. And also, before we go, there's another question I like to ask you. Why is this topic relevant to health professionals?
Oh, because T cells and B cells are involved in most diseases. And I think immunotherapy, which seeks to suppress unwanted response in autoimmune disease like multiple sclerosis and diabetes, or enhance responses against cancer, is likely to transform the treatment of many human diseases in the next 10 years.
Excellent. And now, doctor, for those who want to get in touch with you, how can they contact you?
Well, I'll be back in Australia for 3 days' time, and my mobile number is 0417-345-243, so they can contact me through my phone number if they want to.
Excellent. Thank you so much, doctor, for coming on the show. I really appreciate it.
Thank you very much for getting me.
And that was Dr. Jacques Miller. We've just been talking about his amazing research on T lymphocytes. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. We're also available for download on SoundCloud and iTunes. I'm Tabetha Moreto, and you're listening to Health Professional Radio.